Bonjour. Hi. We're about to get started. So, welcome to When Systems Shift, using data to navigate change in homelessness responses. I say bonjour, I say hi. I feel like most people know what that means. We're in Montreal. I also want to say sego, which is the Kanengyahaga greeting in their language. So, of course, I want to start by acknowledging, one second. So, of course, I want to start by acknowledging that we're on the land called Jogjage by the Kanengyahaga Nation, and also called Munyang in Anishinaabemowin, colonially known as Montreal. This land has long served as a site of meeting and exchange among many First Nations, including the Kanengyahaga of the Haudenosaunee, the Huron-Wendat, Abenaki, and Anishinabeg. And now I'd like to pass it on to Wandu from the City of Toronto for the first presentation.
Thank you, Florine. So my name is Wandu Amenu. Currently, I'm working as a research analyst under Coordinated Access for City of Toronto. So I'm going to present a lot of data points, really, a lot of numbers and the proportions. But before I go into the numbers, I want to provide some context into the number using my own personal experience. So I came to Canada in 2015, and exactly 10 years ago in October 2015, you can hear me, right? Good? Yeah, okay. So exactly 10 years ago, October 2015, was when I landed in Canada. So all the data points I'm going to present here are not only numbers, there are people behind all those numbers. One of them being me, if we go back 10 years ago. So at this time, 10 years ago, I may be calling central intake to give me space in shelter system in Toronto, in City of Toronto, where I am now humbly serving population who are coming from different contexts into Canada and sitting in our cities. Yeah. So all those are numbers, but behind all those numbers are people, individuals, or all human suffering, human uncertainties, and so on. So if you are not a number guy, please put into context of all those factors, and don't be bored with my numbers coming again and again. Okay, thank you. Yeah, so my presentation outline, I'm going to provide the context of the city where I work and I live, and then shelter system flow data framework that we use for our city. It's the most transparent and comprehensive dashboard, I would say, compared with other dashboards that I've been able to access, that captures all the inflow, outflow from shelter system that operates in more than 100 shelter locations in the city. And then I will present to you the monthly snapshot and trends we see since January 2018. Exit to permanent housing, the trends we have been seeing every month, and especially when it comes to chronic homelessness in our city. And I will also touch on topics regarding inflow and outflow, how they relate to each other, and chronic homelessness in family sector. So we have different sectors that operate in our shelter system, use families and so on. One of the areas that we actively monitor is chronic homelessness in family sector. And the last topic I'll present will be our prioritization policy, where we use our data to bring change to the level of homelessness that we observe in our context based on different demographic variables. So the context here is the map of our city, and by the numbers in the 2021 census showed the population size was around 2.8 million population, with a population density of 4.4 per square kilometer. So as I said, we operate in more than 100 shelter locations in the city, and this is the distribution of where they are located, mostly in downtown core of the city. So between January and October of this year, on average, on a daily basis, there were more than 9,300 individuals staying every day in our shelter system. And on October 7th, we had 8,673 individuals. So as I said, we have a very comprehensive dashboard in Toronto, and one of them is the daily shelter occupancy that is updated every day. So as people enter and exit shelter systems, therefore a single bed could be occupied by a number of individuals. So over the year, when we compiled the data over the year, in 2024, we provided overnight service for at least one bed night for more than 19,000 individuals. So this is a huge number of individuals that enter and exit our system in a given year. Even if provided that in a single day, the number is 8,600 or more. So what kind of model do we use? We use a model prepared, developed by Built for Zero Canada to monitor inflow and outflow from shelter system. That helps us to also monitor what kind of population group are more impacted, what kind of population group are more likely to exit into permanent housing, which population group is more experiencing chronic homelessness compared with the rest. So that gives us where to focus when we target different intervention areas. So inflow, we categorize that into three different inflow categories. Newly identified, those are people who have stayed in our shelter system for the first time in the reporting months. Returned from permanent housing, that helps us to monitor relapse into homelessness for people who have exited to permanent housing from our system. Return to shelter, that is a concept we monitor to track people who have left our system but not to permanent housing and are coming back to our shelter system. Outflow, we have two categories here. Moved to permanent housing, those are people for whom we are sure that they have moved to permanent housing, either private market housing or social housing or supportive housing and so on. And then the second part is became inactive. So those are people who have stayed in our system, left the system, but not to permanent housing. We're not sure where they are. In this case, we keep the data for 3 months, and then we classify them as inactive, and they will drop from our list after that time onwards. So those are the 5 really key data points that we monitor every month. It gives us a snapshot of what has happened in the months in our city. Overall homelessness, totally active homeless population, and chronic homeless. So all of this also we break down by age and the gender distribution to have a sense of how different demographic variables also contribute in homelessness. And then this is like a snapshot of what happened in a given month, but then we have also another dashboard that tracks changes over time every month for different population group, the same indicator, the same indicators of inflow, outflow, and overall homelessness, but for different population group. All population, for indigenous people, for refugee population, families, single adult, and so on. So this dashboard gives us how things have been changing every month, starting from January 2018. So I will show you some of the examples in the next slides. So this comes with a lot of work, really, with different community advisory boards. For example, when we report on indigenous data, we don't just report out there. We collaborate with community advisory boards to set definition, to set proper way of asking indigenous question, to also even outline what kind of options should we provide. That goes in collaboration partnership with different community partners. So it's not we own everything. We also work with different community advisory boards to make sure that every partner is engaged from the start of the work. Yeah, so if you Google in, if you have laptop or computer, your cell phone now, if you Google in shelter system flow data Toronto, you will see the graph that's on the left. And this is for August, but you will see for the month of September. And yeah, it's 1 month late than what you will see in your browser if you Google right now. So it tells us the number of active population at the end of the reporting months. So for instance, at the end of October, August, we had 9,858 people who were classified as active homeless. So they stayed in our shelter in the past 3 months at least once and have not left to permanent housing at the end of the month. So those are the people we classify as active. In most cases, I would say around 90% of them would be staying in our shelter system, but the rest 10% will be people who have left the system but not to permanent housing. Maybe they have decided to leave, or we don't know where they went, but they didn't tell us where their final status was at the end of the reporting months. So that is the left side is the inflow side. We have newly identified. Every month when we monitor this data, in most cases we will find newly identified as contributing for most of the inflow number. And then we have return from permanent housing that tells us relapse into homelessness once people have resolved their homelessness experience. And on the right side, we have moved to permanent housing. That's, of course, the favorable outcome that we want to see people once they have that crisis of experiencing homelessness and became inactive. Those are people who have left the system, not to permanent housing before 3 months. So these key indicators tell us what happened in a given month, and we update this data every month. So it's a continuously updated data since March 2021, almost for more than 4 years, which is around 50 months. I am updating this data I've been updating this data every month. It's a huge amount of work from our side, from operations side, all the staff members who are collecting data and so on. This number reflects all this massive work process that goes on in our shelter system. So that is a snapshot of the first dashboard that you will see. If you go to the second dashboard, that gives us a historical trend. We have different population group here, as I have indicated. We have people who identify as indigenous, we have chronic population, refugees, non-refugees, families, and so on, different population group. Every time you apply that filter, you will see trend for the number of active at the end of the month, starting from January 2018. The only thing is for people who identify as indigenous, the data will start from January 2021, and that's based on the new intake form that we adopted, and then also a definition that we have set with TCAB, and final consensus was to start to release the data starting from January 2021. For all other population, it goes back to January 2018. Yeah, so as you can see now how the chronic homelessness has been spiking since January 2018. And I always, when I present this, I will say October 2014 was the crisis point for us because of some factors that I will discuss in my upcoming slides. Why is it not going? It's not going. It's working from here, but it's not showing here.
Slide doesn't go forward.
It goes, but it's not coming on the screen.
It's just, how about we stop it and start again?
Yeah, good. Thank you. Thank you, yeah. That's not my skill. Sorry for that. Okay. So monitoring this first dashboard of the cumulative number of people who move to permanent housing every month tells us different patterns. When some projects close, we clearly see the retraction in the number of people moving to permanent housing, and that clearly tells us a push for the different levels of government or availability of funding to really continue to see sustained movement to permanent housing. This is what we have clearly seen, for example, in 2023, 2024. If you look at the cumulative number of permanent housing between January and August of 2023, we had 3,700 people moved to permanent housing. The next year, in 2024, one of the projects we have is COB. I'm going to discuss that. When COB really dried out, we have seen a massive retraction in the cumulative number of people who moved to permanent housing. So that was something that we have used to present to different bodies, and then also actually to the public. It is released to the public to show how availability of different projects impact system flow. So system flow, when people, the likelihood of people moving to permanent housing decreases, it has really an indirect effect of limiting people's ability to access our shelter system. Yeah, so in the second dashboard, again, the historical dashboard, once you filter for population group, there are different graphs that automatically update for that population group. One of them being net change. We have seen in the months, inflow minus outflow. For example, the current filter you are seeing here is applied for people who experience chronic homelessness. You can see in 2024 where we have really seen a spike in the number of inflow compared to outflow, which means the number of people experiencing chronic homelessness is bulging, increasing from time to time. And that was, in October, that was how we became at the stage of crisis of people, nearly 78% of our people experiencing chronic homelessness. So just below that line chart, you'll see total inflow and outflow for each month. So the first one is the net change. The second graph shows the inflow compared to the outflow in detail for each population group. So if you go for refugee, for instance, you will see how the inflow and outflow was impacted over time. In fact, during the COVID-19 pandemic, we have seen a significant reduction in the inflow for refugee population groups. So those are all the patterns that the dashboard provides to the public, to the researcher, and anyone interested in homelessness in our city. So the second dashboard from the last talks about detailed inflow and outflow. So the inflow, as I presented in the first slide, talks about newly identified return from permanent housing and return to shelter. So you can see all this breakdown for different population groups. So in this case, for example, most inflows are attributed to newly identified population. So the graph on the below the 0 point shows the outflow, where you can see it's more composed of becoming inactive or move to permanent housing. Yeah, so the availability of projects over time does really have a direct association with movement to permanent housing. And one of the projects being COBE, that's the Canada-Ontario Housing Benefit, which was not working in a sustainable fashion once it was launched. It was working as on and off. Sometimes it comes available, sometimes the budget is used, and it has a significant impact on the number of people moving to permanent housing. So in May 2023, for instance, the project dried out, and you can see a significant reduction in the number of people moving to permanent housing from our shelter system. And then when it was launched, at that time the window was really very short, and it was launched in August of 2023, and then we had a good movement to permanent housing from our shelter system. The worst scenario happened in 2024, where the project dried out in March 2024, and then didn't come back until October of 2024. And October is where exactly we had 78% of our people experiencing chronic homelessness. So it just tells the learning point really is if such projects are working, then they should continue rather than, at least it's even actually better not to start, because it has a lot of implication. People who are staying in shelter, once their friends or their peers exit permanent housing through COBE, then they will wait for COBE, right? They will not try to solve their homelessness. And this is exactly what we have seen in our shelter system. And now in October, when the system opened up, exit to permanent housing significantly improved, and chronic homelessness declined significantly, and people were able to enter and use our shelter system when they are in crisis or when they come from different contexts of political crisis in the world in which we live. That's how we speak in Toronto, at least, because it's a multicultural city. People come from everywhere, and we have a huge proportion of refugees staying in our shelter system. So currently now we are having our city-funded COBE project, which is helping to run the COBE project, even if it's not running currently. Yeah, so same data points spoken from a different angle is people who age into chronic homelessness. So when we say age into chronic homelessness, those are people who have stayed for 6 months in shelter for the past year, or 546 nights cumulatively over the past 3 years, those are people who age into chronic homelessness. So every month we track that, and also people who exit to permanent housing from chronic homelessness. So it clearly shows how when COB closes, the gap between the two widens, more people aging into chronic homelessness and less people moving to permanent housing compared with to those who are aging into chronic homelessness. So after October 2024, in November, December, and so on, the trend reversed, took the other direction, where we were gladly seeing more people exit to permanent housing than people aging into chronic homelessness. And currently we are holding at least from events not to happen, similar events from not to happen as last year through our city-funded COB project. Yeah, this could be another interesting graph. I don't know how much you are interested in looking at graph, where we can clearly show in a 2D graph. Of course, people live in a three-dimensional world, and we have a number of things that we cannot present with number, including human suffering, human different qualities of life, and so on, that we cannot show with numbers here, but we can learn how inflow is really affected by outflow. So the graph on the x-axis shows outflow from our system, and the y-axis shows inflow to our shelter system. After closure of COB in around March of 2024, you can see the worst scenario of lower dip in outflow, which has automatically resulted in a lower dip in inflow. It doesn't mean people are not experiencing homelessness, of course. What we are measuring here is people who are accessing our system. So the dip in inflow also shows that we were not able to accommodate people because the people are stuck in our shelter system. There is no movement at all. And most probably people were waiting for the COB project that helped their peers move to permanent housing through cash flow. And those all graphs can be drawn from for academics, people working in university and so on, or doing research, who are interested in doing research in homelessness in Toronto. They can download the data. The data is downloadable. It's in CSV format. In the shelter system flow data, there is a link to that open data, which can be downloaded, and people can do different types of graphs and patterns of homelessness. Yeah, another point here, especially when it comes to people staying in family sector, is where we are seeing a huge shift in chronic homelessness. Back in 2018, 2019, there was really a huge movement for people staying in family sector, where we had maybe 20% or 30% of people experiencing chronic homelessness in family sector. But recently, you can see how the thing is really in outbreak mode. It's in crisis mode. In October, we had the worst scenario of 88% of people staying in our family sector. Those are with kids, less than 10 years of age. 88% of them were experiencing chronic homelessness, with all its psychological, social implications. And when COB came back again, we are seeing currently a positive trend, really, even if it's not close to what we have been seeing in 2018 or 2019. We are seeing a positive trend of around 79% the last time we reported in August 2025. So to see this is supporting around 2,000 people in family sector to move to permanent housing. So it's around 600 family units, rough estimate. And at the same time, it is accommodating also all those 600 family units into our shelter system. So it works both ways. It's also helping people to move and helping other people in crisis to access our shelter system. So similar scenario for refugee too, where we had 83% in October 2024, the crisis point for homelessness system in the city of Toronto, and now we are at 82%. Yeah, so I keep on talking about family now. The last presentation about family is also really a shift. It's not only about the increase in prevalence of chronic homelessness among families, but the type of chronicity is also shifting now. So previously, if families were experiencing chronic homelessness in our system, most of the time they stayed in our shelter between 6 months to 1 year, as you can see from the graph. But in recent year, the shift is really very massive, because most cases we will see families staying from 1 year to 3 years in our system compared to the people who are recently joining chronic homelessness. So it's not only the chronicity increasing, but the length of stay in our shelter system has also increased for families, which has a huge implication really for families who are in crisis mode and need shelter service from the city, which calls for all levels of government really. If projects like COB starts, don't stop it, please. That's the message we want to emphasize as a city. Yeah, so this is about the dashboard, and then with the dashboard also we release open data. So the dashboard doesn't tell all the data points, all the trends, and any user interested in doing further insight, further analysis can download the data. It's in CSV format and do different types of analysis to help shape intervention on homelessness. So it is our city council's direction to go for to promote open data, and if you go to open data in our city, you will find, I think it's more than 400 different open data sets, and one of them is the shelter system flow data. Yeah, so all the key data points that I've mentioned are included in the open data. Actively homeless, inflow, newly identified, return from housing, all those are provided in different columns in the data set. And all data population group, refugee, indigenous, and so on are also included in that open data. So the format is in CSV format, so you will get the date, months of the data. So for example, for January 2018, you will find different population group, all population, chronic, refugee, except that the indigenous group will start to pop up in January 2021. And then we have all the data, key data points, newly identified, returned from housing, returned to shelter, moved to housing, became inactive, and actively homeless population. And then we have 7 different age group, less than 16, youth we define as 16 to 24, and all other age group, and then gender, male, female, and trans gender population group. And my final presentation is about our prioritization policy, where we use the data to and implement it in action for matching people for different housing opportunities that's made available to us. So the policy context is, we know we conduct SNA. We have our point-in-time count that we regularly conduct. The latest one was released in October, conducted in October 2024 and released this year. And every time we run that point-in-time count, we do the level of homelessness among different population groups. And we know in our society there are some population groups that are overrepresented compared to their makeup in the city. For instance, indigenous people make up, according to the census, around 3.2%, but among the homeless population, they make up 9%, which means there is overrepresentation of this population group. And this is knowledge we learn from the point-in-time count, and the intervention is therefore, what should we do? Out of the housing opportunity made available to us, we intentionally target to achieve 25% of housing outcome for people who identify as indigenous. That, in the long run, may reverse this pattern we are seeing in regards to the magnitude of homelessness among different population group. Racialized group, Toronto population 56%, but among homeless population 77%. Toronto population, for example, for black people, they make up 10%, among homeless population 58%, even if there could be different international level migration and so on playing in this statistics we see, but we intentionally also target to achieve more housing outcome for people who identify as black. So this prioritization policy, the idea is to set equitable resource distribution based on the magnitude of the variations or the disparities that exist within the society. And this policy is reviewed annually, and all the major advisory boards in our community are also involved, including TCAB and TAEH. TCAB is Toronto Indigenous Community Advisory Board, and TAEH, Toronto Alliance to End Homelessness. We usually collaborate with these two community-based boards when we make such kind of decisions. So how does it work? So we intentionally plan throughout the year to have such kind of distribution for housing units that are made available to coordinated access in our division. So people experiencing chronic homelessness, at least 75% of them should be people experiencing chronic homelessness. That's our target throughout the year. Indigenous people, 25% we intentionally allocate for people who identify as indigenous. Youth experiencing homelessness, again, 25%. And for the rest, we have criteria of being chronic. Seniors who are experiencing chronic homelessness, 25%, and including women and the women-led households experiencing chronic homelessness for 40%. So when we make this report or when we analyze this data, it is based on the concept, the social construct, rather than the person. So there could be an intersection or an interaction between different variables. A youth can be indigenous, or a woman can be youth. So it's not like for the person, it considers all those intersectionalities in the social construct that we believe is playing a role in people experiencing homelessness. So how do we monitor this? So periodically we report to TCAP and also to different bodies. We also internally monitor this data to ensure that we are achieving what we intend to achieve for the year. For instance, this is what we have achieved for 2024 from January to December. People experiencing chronic homelessness made up 87.8% of the people who were helped to move to permanent housing through our coordinated access unit. So we have two projects here, PAS, Priority Access to Housing with Support, and Rapid Rehousing. And those two projects are where this prioritization policy is applied. So people who self-identify as indigenous, for instance, in 2024, out of all housing outcome recorded under coordinated access, 23% were people who identify as indigenous. So this is really, it's not, we didn't achieve the 25% target we want to, but compared with the routine exit to permanent housing, it's a significantly higher. Because if we are not intentional, if we leave the system as is, what we see is in 2024, from shelter exit to permanent housing, indigenous people account for less than 10%. But by being intentional, we were able to achieve this 23% of housing outcome under coordinated access went to people who self-identify as indigenous. So it's a self-report that we use for this reporting. So for seniors, we've achieved our target. So it's a minimum of 25%. And for Black people, we've achieved our target in 2024. And the rest is like that. So it's monitored both internally and at the same time through meetings with different community advisory boards. Yeah, key message, therefore, for our presentation now is Shelter System Flow uses an established model of monitoring key indicators on homelessness, updated monthly with briefing note and open data, and can be accessed by anyone, anywhere who is interested to work in the topic of homelessness. Inflow to the system, including re-entry to the shelter system from permanent housing, is directly affects outflow. It's directly related to outflow from the system. More outflow, we see more inflow into our shelter system. In recent times, because of opening and closure of projects like COBE, people staying in family sector are experiencing high level of chronic homelessness. COBE, as I have stated, has really helped a lot of people to exit homelessness to permanent housing. System level data has been an important input to the development of our prioritization policy that we use, and which is helping really to achieve equitable allocation of limited resources that is made available to coordinated access. And thank you very much. Okay.
Thank you again, Wandu. Now passing it off to Dr. Tyler Roberts, and we'll do the Q&A, joint Q&A at the very end. Go ahead.
Hey, changes. Cool. Awesome. So thanks, Wandu, for the great talk. And thanks, everyone, for coming today. Today, I'll be talking about when systems shift, using data to navigate changes in the homelessness response. Did I jinx it? Might have jinxed it. Sorry.
I'm not sure what does that.
I'm not sure.
All right, let's close it. This one?
Yeah, Roberts, the second one, sorry.
Roberts. Sorry about that.
Sorry, I broke it.
All right.
Cool. Awesome. So I just want to start off and say that I and other colleagues from Homelessness Trust join you here on this land from Edmonton, Alberta, which is situated on Treaty 6 territory. I'd like to begin by acknowledging that we are located on the unceded Indigenous land, of the Ganyan-Gehaga Nation, and is recognized as the stewards of the lands and waters on which we gather today. The Jojage, or Montreal, is historically known as the gathering place for many First Nations. And as visitors, we'd like to thank these communities for welcoming us. So before I begin, just a little bit about Homelessness Trust. We are a community entity in Edmonton, Alberta, and we lead the efforts to end homelessness in Edmonton. We're responsible for stewarding provincial and local plans to end homelessness, and we take funding from all three levels of government in order to meet our community's priorities. We ensure compliance and contract reporting, we invest in programs, housing supply, and we build community capacity to end homelessness. Through implementation, we do lots of community planning and engagement events. We review and invest in what works, but we're also really not afraid to take risks. And it's one thing that we really pride ourselves is on taking risks and trying to find innovative ways to end homelessness in Edmonton. So for the objective of today's talk, hopefully I'm going to show how data can illuminate the real world impacts of policy and program shifts in homelessness response and how those insights can be used to guide more adaptive and resilient systems. So first, I'm going to set the stage and go over why good data matters in a homelessness response system. We just saw a great talk on why real-time data can be used to powerfully impact and design policies that make sense for the community. Then we'll go over tracing the shifts and see why major policy and program changes since about 2010 and how they can help shape intake, inflow, housing, outflow, optimization, all those nodes that we're really used to exploring in a homelessness sector. And then from these case examples, we can look at the highlights for both the intended gains as well as unintended consequences of maybe how the policies impacted data in a way that wasn't expected. So I'm not going to go over everything on this slide and why data is important, but needless to say that having good quality, timely data can help with multiple aspects of who we serve in the community. And because of that, striving to have this good, accurate, timely data can help you not only react to a situation that be happening, but also forecast and predict and hopefully get ahead of a problem that may be happening in the future in a specific community. As Wanda just went over, there's three major nodes that are common in a lot of homeless systems, that being inflow, optimization, and outflow. And ideally, we're going to reduce the number of inflows in any given period of time and make sure they can move quickly through a system and outflow into permanent housing or a housing need that suits the participant who we serve. But every policy change that I'll be walking through today kind of touches on at least one of these nodes of the model, some for the better and some with some unintended impacts that I'll go over in a bit. But with real-time or quality by name data, we're actually able to do quite a bit with it. So one, again, just went over some dashboards that Toronto has. But Homelessness Trust has a plethora of dashboards, public-facing dashboards, where you can see exactly what's going on in Edmonton in the landscape of homelessness. We can see the number of people who are connected with services, and this can be broken down by gender, by age, by Indigenous identity, and we can kind of see, we can get a snapshot, real time, of the homelessness landscape that's going on in Edmonton. But this mostly touches on the inflow, but we can also look at the outflow or the housing data that we have. So here we can see the number of housings that we have in any given month. We can see how long it takes to house those individuals And we can see for the year to date, for example, how many houses and how many housings we've achieved, and are we getting closer towards our goal. But having this kind of data in real time is really important because it lets you see trends. It lets you see spikes or dips in any kind of data point. So if we notice for 1 month that a time in housing is really long for some reason, then we can flag it and be like, is this a new trend that's going to be happening, or is this just truly a blip in the radar? So quality data like that can kind of help you monitor in real time before any major issues arise in a year from now or by the next pit count, for example. Yeah. Now, before I take a deeper dive into some specific examples, I'm not going to read you everything that's on the screen here, but these are just some notable changes to policy and legislation and initiatives to the sector at all different levels of government, whether it's federal programs or initiatives like Reaching Home or the HRIF as recently as last year. Federal projects have really been designed to help improve the situation at a broader level than we could argue with municipal and provincial changes. Provincially, Alberta has made numerous changes over the last decade or so that impact the homeless serving system. These numerous changes and redevelopment of income supports, for example, between 2019 and 2028 in the future are something that I'll touch on in a bit later. In Edmonton as well, Homeward Trust has been able to contribute and observe different changes in the homelessness response over the years, and whether it's contributing to revisions of the homelessness and affordable housing strategies, or being part of zoning changes to help build low-income or supportive housing, municipal changes are really easy to see their impact at a local level. So there's 3 main examples that I'm going to walk through today. That seemingly may not be obviously to impact the homeless serving system, but they do touch on the different nodes of the homeless serving system, inflow, optimization, and outflow in different ways. The first one, I'll be looking at the assured income for the severely handicapped, or AISH as it's called in Alberta. And this was an income support program tied to the cost of living until 2019, and then it was de-indexed and later cut or clawed back a little bit. Next, I'll be looking at the Social Housing Accommodation Regulation, or SHAR as it's called. And we saw that policy shifts in 2017 altered eligibility and prioritization rules for subsidized or social housing. And the last example I'll be touching on is the Encampment Navigation and Support Center, the ENSC, which opened in Alberta in both Calgary and Edmonton. But I'll be focusing on the Edmonton one specifically for the purpose of this talk. So the first case example I want to talk to focuses on income supports and housing stability. So the assured income for the severely handicapped, or AISH as it's called, is transitioning to the Alberta Disability Assistance Program. And what this was designed to do was to stabilize income levels for those who cannot work because they're severely handicapped, as it's called. However, inflation, indexation, and clawbacks on this benefit notably interact with housing affordability, and it really raises the question, what happens when fixed incomes do not keep pace with rent increases, So just as a shortened version of the AISH timeline, AISH has been around since the late 1970s, but however, since 2018, there's been some notable changes on it that I'll just quickly walk through here. So in 2018, Bill 26 introduced that AISH becomes tied to the Consumer Price Index, which is another fancy term for inflation. So as inflation goes up, the AISH benefit will try and keep pace with that as much as possible. And then in 2019, the AISH benefit actually increased to $1,685 a month. But later in the same year, in 2019, indexation was paused. So this led to AISH flatlining for a few years at $1,685 a month. It was no longer tied to inflation. So even if inflation skyrocketed as it did between 2019 and 2023, then there was no mechanism to capture an increase in AISH. In 2020, Bill 21 removed any kind of legislative protections on AISH. So rather than a legislative change, it could simply be changed with regulation, reducing a lot of the red tape involved in changing age up or down depending on the market. In 2023, in response to kind of an inflation crisis that was happening at the time, indexation was resumed for AISH, so AISH was once again tied to inflation. So after 2023, we saw an increase in the AISH amount, but most recently this year, the government announced that AISH will be clawed back based on the amount of the Canadian disability benefit that somebody earns. The Canadian disability benefit is a federal benefit for the severely handicapped, and a lot of participants rely on that to top up their AISH amount. But the government announced that it would claw back dollar for dollar their Canadian disability benefit from their AISH. So if they earn $200 from CDB, the government would claw that back from the AISH amount. And then looking forward into the future, the AISH is going to be renamed to the Alberta Disability Assistance Program, and then the model is going to change and the amount is going to change as well. But what does this look like in practice? So if we take, for example, the average rent for a one-bedroom apartment in Edmonton, based off CMHC numbers, we can see that the maximum AISH allowance does allow you to afford a one-bedroom apartment. But when we add the additional context of the policy flags, as indicated in the dashed lines, we can see that for several years, the AISH allowance is flatlined because it was de-indexed at the time. It wasn't tied to inflation. But notably in the green line on the bottom, we can see rent prices start to increase around the same time. But thankfully for people on AISH, it didn't skyrocket. The rent prices in Edmonton didn't skyrocket at the time, which was good news. But looking into the future though, when we see that AISH will be clawed back by $200 starting in 2026, and this will bring it closer to the average rent price for a one-bedroom apartment. As you can see, the trend for a one-bedroom apartment is probably going to go up, if not stay the same. So we're getting closer to that. All that money from AISH is going towards rent. Now, rent is not the only expense, as you might guess, in a living. There's groceries, there's transport, there's any kind of medical costs associated with just living because you're severely handicapped. So the fact that this benefit is being clawed back and we're getting closer to the price of a one-bedroom apartment is something that we may want to keep an eye on moving forward into the future. So from this, even though there's no housing data directly tied to this, there's several lessons we can learn from this AISH change in policy. One, we can see that there's a clear benefit flatlining. And because of that, chances are we might see an overrepresentation of participants on AISH or on a handicap benefit in our population. Currently in our supportive housing and housing first populations, 30% of those people are on AISH. Moving forward in the future with the clawback plus increased rent prices, I suspect that we'll see even a higher proportion of our participants on AISH in the future. But this kind of emphasizes that indexation or adjusting benefits in accordance to inflation can really play a critical role in housing prevention. Now, I don't think anybody here is arguing that AISH is a way to end homelessness by any means, but for people who rely on these income supports or any fixed income support, it certainly can be a preventative approach for those who may be precariously housed. Okay, so my second case example that I want to walk through focuses on shifting prioritization in social housing. So the Social Housing Accommodation Regulation, or SHAR as it's called, had several reforms in 2017, and this raised asset limits as well as reweighing prioritization for those who could apply for social housing. Now, this was intended to increase eligibility for households with dependents. So this gave families an option to apply for social housing. But one of the questions here is, how did prioritization rules change who access social housing before and after the changes in SHAR? Now, one of the things we can look at is Savita. Savita is a social housing or below market housing. I don't know if it's just in Alberta. For sure, I have the data in Edmonton anyways. And what we can see is that by year, for a one-bedroom apartment before the changes in SHAR in 2017, we can see an upward trajectory basically in every kind of application, whether it's 1, 2, 3-bedroom or bachelor unit suite. Now, this doesn't really point to a lot in this slide, but when we look at the proportion of people who are on these wait lists for social housing, the story becomes a bit more clear. After 2017, one-bedroom units rose steadily as a share of all applications, while bachelor units steadily dropped in the orange line here. Now, this shows us that it wasn't just more applicants overall, it was a change in the mix or the composition of the applications or the waitlisted groups. SHAR reform didn't just increase eligibility broadly, but they effectively reweighed prioritization in favor of individual or families requiring one-bedroom housings. Now, for planners, this kind of tells us that policy tweaks at the access point can cascade into significant shifts in kinds of units that are most in demand. And again, this is just a pie chart showing that in 2016, we can see a large representation in bachelors at 20%, as well as 3-bedroom. But then if you zoom ahead to 2019, a year before to 2 years after the shift, it basically evens out to equal weighting for across all 4 different kinds of applications at Savita. And again, this is just due to the shift in eligibility and asset limit requirements, allowing more families to apply, while those single adults were maybe left behind. So again, what I just showed you was that broader eligibility led to access to more supports for families or for individuals with dependents. From this, obviously, families greatly benefit from this. They could apply for social housing, they could apply for low-income housing, they can have a place to stay that they can call their own. However, what we saw is that people applying to bachelor units, or probably most likely single adults, may have been left behind in this process. And that's not to say that these reforms were necessarily a bad thing. It's just that when policy changes like this, prioritizations design, they must balance equity, fairness, and throughput. And when you're making these changes, don't just think about who you're including in the new eligibility criteria, but think about who you may be leaving behind because of those changes. Now, if there's other options for those single individual adults, that's fantastic. But if they were left to be referred to somewhere else, or they were left on their own, or they're on the wait list for forever, then maybe that's somewhere where the policy changes can be a little bit more thought out or fleshed out before they're implemented. So the last example I want to go over focuses on access expansion in the homeless serving sector. Notably, I want to talk about the Encampment Navigation and Support Center in Edmonton anyways, which opened in January of 2024. As of August of 2025, which is the most recent stat that I had, they have served nearly 8,000 people. And we know that both the one in Calgary and Edmonton have served over 15,000 people. And this was designed as a central hub of supports. Now, it's important to note here that the Encampment Navigation Center was set up at the same time that encampment response was in place. So this was a spot that people can come from encampments. They can go to this Encampment Navigation Support Center and connect with a lot of different resources such as ID supports, benefits supports, income supports, housing supports if they needed it. It's a one-stop shop for basically any kind of logistical needs that they may need to get back on their feet. It's important to note, though, that the Encampment Navigation Support Center is not a housing solution. It was only designed as a place that participants could go and seek out any kind of needs that they may need in terms of connecting with different services rather than finding a housing solution. However, this might have revealed hidden inflow pressures, and this dramatically coincided with a reshape in our by-name data dynamics. And to raise the question here, how do new access points change the balance between inflow, intake, and throughput? Now, I've mentioned intake a couple times here, but what do I mean by that? So just as a broad overview of Edmonton's by name data, we have multiple system access points. So for one example, being the Encampment Navigation Center, but it could be a library, it could be a health center, any place that somebody can come in and say, I need housing support, can you help me? Then those people are referred to coordinated access, where they're done assessments, whether they're singles or families, where they're assessed for the best type of housing that may suit their needs. And then they're matched with a housing team to help find their permanent housing solution, and then they're housed. But what we can look at here is the intake process, or the step at which that participants are matched with a housing team. So here in the first chart, what we are looking at here is the absolute number of people who are connected with a housing team each month, before and after the Navigation Center opened in January of 2024. Now, before January 2024, we saw a modest growth of about 8 additional people per month. However, after January 2024, that growth nearly doubled, rising to about 15 people per month that were connected with housing teams. Now, the key takeaway here is that a lot of people were connected with housing teams here. It shifted the scale of intake, whatever is happening in January 24, whether it was the encampment response at the time or adding new access points to the system. It shifted the scale of people connected with housing teams. And this introduced a larger number of people into the system waiting in line to find their appropriate housing. That rapid acceleration kind of sets up downstream pressures after people are connected with housing teams that we'll see in a couple of seconds here. So this chart here shows the proportion of Edmonton's by name data that was made up of people connected with housing teams out of all of our data. Now, before January 2024, the proportion was relatively stable, hovering at about 38%, and it was essentially flat. After January 2024, though, the proportion declined significantly at about 1% each month. Now, this is really important because even though the absolute intake numbers rose in blue over there, intake is making up a smaller share of our by name data overall. And this suggests a surge of people were being captured earlier, or our inflow is being heavily overrepresented compared to those who were matched with housing teams but still waiting to find suitable housing. And lastly, this chart looks at how long people were waiting to find their housing once they're connected with housing teams. Before January of 2024, we can see that it was a slight increase each month that people were waiting to find their suitable housing at about 0.3 days per month, or about 1 extra day every 3 months. However, after January 2024, we saw that almost double at about 0.5 days per month, or 1 day every 2 months. Now, taken together, these 3 charts with lots of dots on them suggest that the Encampment Navigation Center, or the encampment response at the time, correlated with an increase in the intake population. It also helped reshape the dynamics by shifting more people into the front end of our coordinated entry systems. This slowed the progression through the whole process, as you can see in the increase in time to housing. And this resulted in greater pressure on housing teams, longer wait times, and this really highlighted the need to align access expansion with more downstream supports and more throughput supports. Now, the idea of the center is a fantastic idea to have a one-stop shop for all these supports. But again, adding more access points doesn't necessarily mean that more people are going to be housed quicker. If there's no supply on the other side, once the match with the housing team, then that's kind of where a lot of things can get bottlenecked. Looking at this one, if we look at the average number of times a person has connected with the homeless serving system, unfortunately in our data, many people have to reconnect, whether it's through lost contact or there was an event that happened that they had to lose their previous housing support. Our average number of times, we could track the average number of times that people have connected with our homeless serving system in Edmonton. And we see that there's a clear downward shift in the average number of times that a person has been in our by name data. Now, you could argue that this is a seasonal shift, and if you look at the peak in April, for example, it declines after that as well. But when you look at the median number of journeys that someone has in trying to find their housing, we can see that those seasonal changes are no longer present. And around the time that the Navigation Center opened, combined with an encampment response at the time and other macroeconomic factors that really painted a bad picture for a lot of people, the homeless serving system saw a wave of new people that have never connected with the system before, starting in the blue and then continuing up until May of this year. Now, what this really is intended to highlight is inflow without throughput. Just because we want to capture as many people as we can in the system. We want to know an accurate number of people who need those housing supports. However, we need to build throughput. We need to have, it's not just a case of adding more housing teams, it's more of a supply issue on the other side of it. We can have all the housing workers matched with a participant all we want, but if there's no housing supply at the other end of it, then by the end of it, you're just left with a bigger and bigger pile in the by name data with, housing workers already stressed, already at capacity, just amplifying the pressures that are needed in trying to find the participants suitable permanent housing. So just to wrap up on the Encampment Navigation Support Center, it expanded access to the homeless serving system. And it really showed that people connecting with housing teams increased actually at the time, but the line of people waiting to connect with those housing teams got even longer. Now, again, this is intended to highlight that access initiatives must be combined with downstream housing strategies in order to avoid these bottlenecks that are at the beginning, leading to more frustrations, leading to longer wait times, and just leading to overworked housing workers as well, because they're taking on more people than they ever have before. So this kind of leads to strengthening system resilience. We can do this by aligning access expansion with throughput. Obviously, easier said than done. Just build more houses. Of course, how do we not think of that? But when thinking about these new access points that you're trying to add to a system, whoever's implementing that policy, okay, do you have a plan for these people? Do you have options for these people? Do you have any idea where they may end up? Or is there a backup plan? You're inviting all these people into the system. Where are they going to go? Where do you want them to go? So we can pair these new entry points with downstream housing capacity and supports. Second thing we can do is that you can stress test these policy changes. And like on paper, you can do this. You can model potential impacts of legislative and regulatory shifts. I know there's been several communities that have modeled future projections on this by doing multiple simulations, such as staying the same, improving an economic situation, or if there's an economic downturn, what does that do to your homeless population in the future? So again, you can kind of stress test these policy changes on paper just to get an idea of how this could impact your future homeless population. So again, with AISH, for example, currently 30% of our population, if you decrease that amount without taking it away, we know that more people on our by name data are probably going to be on income supports because they're severely handicapped, even though they are on a benefit. And then lastly here, we can use by name data proactively. So a lot of the things that we tend to do could be perceived as being reactive monitoring rather than proactive monitoring. But if you're able to, if you can do scenario forecasting to anticipate surges before they overwhelm the system, that's obviously an ideal state here. So for example, when you add new access points, maybe, don't be afraid to ask the hard questions, like how is this going to impact housing workers? How is this going to impact the current system that we have? Just because you have more people accessing a hub of supports, for example, how is that going to impact the system that we rely on so heavily to do our work and to help the people as quickly, as properly, and as accurately as possible? Lastly, I just want to focus on some things that I didn't touch on, but I think it's worth mentioning here. Screening accuracy matters. So I have folks here from Calgary who recently redid their coordinated access or their assessments. And screening accuracy is really, really important here. This can help reduce mismatches that can cycle participants through inappropriate programs, so they may end up frustrated or they feel If they feel unincentivized to even connect with the system a second time because the first placement didn't work out. So screening accuracy here really matters. Also, we can apply an equity lens on prioritization to ensure that families, singles, Indigenous participants, and high needs clients aren't sidelined by regulatory shifts. But also when you're building these prioritization changes in policy, like with SHAR, for example, again, it's not just important to think about who you're including now, but think about who you may be leaving behind with those policy changes. And do you have a roadmap for those participants that you may be leaving behind? Do you have other options? Do you know where they can go? Other alternatives? And lastly here, continuous recalibration mechanisms are really important to revisiting such things like prioritization criteria. I say annually here, but really this could be done biannually or as needed to help kind of adjust for any kind of inflow patterns and housing stock changes that may be arising in a current community. I'll skip that. So there's some, oh yeah, no, that sounds good. Policy and cross-sector collaboration. So all these things kind of really invite collaboration, not just within the homeless serving sector, but across different community entities or community pillars. So here, as soon as we get wind of a policy change that may be happening, it might be, like, again, easier said than done, but engage with the government as best you can to ensure that things, if they realize the scope of the impacts that they're, of the changes that they're proposing or they're going to be making. If they're aware of it, then, and they're going to stick to it, then that's fine. We can come back to our way and we could plan accordingly. Secondly, you can collaborate beyond housing. The homeless serving system gets a lot of the blame for a lot of things that happen that are well beyond our control, whether it's failures of the health system, the education system, the justice system. The default sometimes is to just blame the homeless serving system. But by collaborating, by linking health and justice and income supports data, you can really capture the true cost of misalignment or any kind of services that or people that you may be leaving behind. And coming together with that kind of information, power in numbers, against people who may be proposing policy changes will really go a long way than just one community entity saying, hey, don't make these changes because here's what you'll be leaving behind. Power in numbers like that is going to be really powerful. And lastly, we can position system planners as translators. And here we can really use data to connect frontline realities to policymakers in ways that shape upstream decisions. So it's not just us coming at them with numbers, but we know all the data. We know all the experiences from frontline workers. We know several things like that. And if we can come in armed with the facts and the experiences and the sentiment behind that, then that'll make for a more compounding argument and kind of trying to advocate for any kind of change. So moving together, we can use data as early warning systems. That's interesting. Here, it's really important that this is system learning, not blame. We're not trying to blame any of these policy changes. We're trying to more learn from them and learn how we can take the changes that were made previously and how to reshape or think about more thoroughly future policy changes. And capacity and alignment, again, like I said before, introducing more access points is fantastic. If you can walk into anywhere and receive a referral for any kind of housing supports, that's awesome. But think about that throughput, think about the other end of it. Just because we have more access points, is that going to actually result in more housings? It's good to know that those people are there to get a more accurate number of the housing or homelessness picture in a community. But are they just going to be waiting in a line? And lastly, we can go from post hoc to playbook. There's kind of these post hoc analyses that we can do on data that is several years old at this point, can be really used to inform how we tackle future changes or how we handle real-time emergencies, for example, and try and plan proactively instead of reactively. Thank you.
Thank you both so much. We're now going to open it up to questions. There's a microphone up here. Feel free to come up and be sure to speak into the microphone. Si vous avez des questions en français, vous pouvez les poser aussi et je vais m'occuper de faire la traduction.
Hi, my name's Ian. I'm from Threshold Homes and Sports out of Kitchener. We do supportive housing for individuals living with severe and persistent mental illness, outreach, and providing housing. My question is, it's for both of you. In terms of like individuals going from chronic entrenched homelessness, whether they're living with severe persistent mental illness or not, did the data inform any programs or services? Because often people that go from those situations to being housed struggle with being successful in those settings. Was there any sort of lessons learned, I guess, from the data, whether it's from City of Toronto or Alberta, that we could maybe take away from this? Yeah.
I'll answer for Edmonton. I know, like, currently Edmonton is investing heavily into supportive housing for participants with severe mental illnesses or mental health needs. So I think that is a consideration that's already in place. Can it be better? Absolutely. But it's stepping stones towards the end goal, which is resolving homelessness for everybody. Mm-hmm. But I know for sure that we are investing in dedicated supportive housing for those with mental health needs.
Yeah, I can say something about this. In Toronto, we have housing-focused client service. We don't leave people once they move to housing as an end business, but we also provide them with housing-focused client service. People are continuously being served not to fall back into homelessness, and that includes people with different types of health needs. So we have STARS assessment. I don't know if you have heard it. And during intake, we also ask different types of questions to gear the service we provide based on their need. One of them being health and related services. Mental health is one of them. Mm-hmm. Physical health. Those are all the assessments we do prior to helping people to move to permanent housing. Once they are housed, they are also provided with this housing-focused client service, at least intensively for 1 year, to ensure that the transition from homelessness to housing is as smooth as possible. Yeah.
All right, thank you.
Thank you.
My name's Max, and a question about, does your data collection and your dashboards tie into encampment information, so people that are sleeping rough? And is that link made through the system?
Yeah, that's a wonderful question, really, because we don't want to only talk about people staying in shelter, right? So the data I presented here talks about shelter system flow for Toronto. But we have also other data points that we track. For example, unmatched callers to shelter system, people who call central intake but are not able to access shelter system because we are fully occupied, because of all the multiple factors that I have talked about. So we have that as a separate dashboard where we track the number of people who are unmatched, who call central intake but are unmatched. So as you are, I'm sure, aware, so it's a big division. So I am responsible for the shelter system flow data, but we have also other departments that deal with all those other data points, including unmatched referrals. So we have other data points that really talks about encampments, unmatched callers to shelter system, and also for families. For example, we have triage and bridging program. If families we cannot accommodate because people are continuously staying in shelter, there are other services that we provide to people to ensure that families don't end up sleeping outside. So those are all different data points that give us at least some full picture of the overall dynamics of homelessness in Toronto.
For Edmonton specifically, I don't think we track encampments. I know we do track unsheltered individuals, which by extension may be that. But in terms of like encampment response specifically, I don't think we track them. I know Hamilton's done a really good job recently in the last couple of years of keeping the number of encampments tracked, knowing who's in there, knowing the number of people that are in those encampments. But for Edmonton specifically, I don't think we track encampments.
All right, thank you.
I just wanted to answer your question for a bit before I ask you your question. For the mental health data in Kitchener, they're on HIFIS, so there is a way to track mental health data within HIFIS, and I think our community in Guelph, we're going to start doing that very soon. Okay, I can have a chat after. My questions are specifically talking about the data. It's so important that the data going in is really good data. So I'm wondering, how did you train your system to input good data? And also, how often are you having to clean your data? Like, are you cleaning on a monthly basis, a yearly basis, things like that?
So I'll go first as the babysitter of our data. For data quality, we have a kick-ass training staff in Edmonton and a Homer Trust. So just making sure that the staff get the same training, the same in-depth of training, and if there are any questions, just making sure that you're super accessible and willing to help them out in case there's any data quality issues. But if there are any persistent data quality issues, don't be afraid to go back to the teams and be like, hey, we noticed this. Why is this happening this way? How do we fix that kind of thing? In terms of data cleaning itself, it's more of a monthly basis, especially in terms of the number of housings. We're pretty on top of our by name data, but for housings specifically, we do a monthly review just to make sure that we're not missing or misrepresenting the data in any way.
So the first time I have this kind of question, I said we had perfect data. Now I learned over time that there is no perfect data. So yeah, in our case, we have really different areas of making sure that we have quality data. At least we have good data to report out. The first is there are a series of trainings that staff are encouraged to take, and it's online. So over here, staff turnover is of course a challenge, and whenever there's a new staff and so on, the trainings are available online. It's on ELI, we call it employee training portal, where staffs are encouraged to do refresher training, and yeah, so we have such kind of activity pre-involvement with the data. Post data, when data comes to me, I do the analysis every month. We have different tools that we use to make sure that the data is good quality. One is the tool prepared by BFZ Built for Zero, that thanks to very much, it's called a reliability tool that tracks if the numbers correspond from month to month, that we are not seeing a huge detachment of the number from last month compared with this month, because people could continuously stay in shelter system, right? So we have such kind of monitoring system. At the same time, we are providing service for people experiencing homelessness. They may not have ID and so on to verify their identity. So there is also a continuous system improvement in our HMIS of merging people when clients find the same client with different names. Their files are merged into the same unique ID on a continuous basis. So those are the two things I monitor from my side. But there are trainings and so on, which is continuously going on for staff when there is staff turnover and so on. Yeah, thank you. Thank you. Yeah.
Thank you. Thank you for allowing us to ask you. This data really helps. As a lived experience, I want to ask you, how possible would it be to make like a spider web data where every database is collaborated together? Like for instance, like Unemployment Canada, how they have their database, who's getting hired, who's getting laid off. And same thing with the education system, who's graduating and how many ungraduated are happening. Because those are making the homeless make easier. So is there any way that we can collaborate all the data together to make a preventative data where we can be aware or ahead of time in our services that we serve to the homeless people, what's to look ahead of time, like seasonal, or a database like a disaster event happened when a lot of people lost their home in Fort Mac, I've noticed that there were a lot of affected homeless 5 years later because those were busy working on helping those homeless people who lost their homes. So like any kind of these database, short-term data, long-term data, would it be possible to get all collaborative data put together to make prevention programs like this? Thank you.
We would love to. The issue is there's a lot of things, a lot of barriers in the way that prevent the data from being shared across communities, which is really unfortunate because I know, especially if you're moving from community to community, it would be so nice to know what a participant's history is, even if it's within the same province. What services did they receive, in Ottawa first, and then they moved to Toronto, and now they're in the shelter system. What's their case notes? What are they coming to Toronto that we should be aware of? But unfortunately, there's a lot of hurdles in the way of a shared database.
Yeah, I think I don't have a lot of things to add. This is like an excellent idea, strategic idea, moving forward to make sure that people get the service they want in a coordinated way rather than in a fragmented way. But in the long run, is it long term or short term? Who makes the decision? And maybe privacy may come into play here because if data is moving from one sector to another sector, we may unintentionally expose people's status or that they don't want to reveal to other sector. Yeah, maybe there could be a lot of debatable areas, but it would have been a fantastic setup if we have such kind of system where data speaks to each other from one sector to another. Yeah, thank you for the question.
My question is about the precariously housed. So a family of 5 to 7 living in a 1-bedroom. Do either of your cities actually keep track of that? So let's say they're newcomers, big families, there's only a 1-bedroom, maybe a 2-bedroom for 7 to 9 people living in there, and then they come to whether some kind of outreach asking for housing, like better housing. Do either of you collect that kind of data? I think
Short answer is no. But I know that there are several initiatives that, like for example, if a family is living in a hotel room, for example, I know there's some initiatives that have been historically out there to try and get them in a more suitable housing situation out there. But for our regular data, we don't report on the precariously housed. I know there's a lot of initiatives for like diversion services to prevent them from getting to the homelessness status. But in terms of precariously housed, nothing that we regularly report on anyways.
okay.
Yeah, maybe if we are talking about hidden homelessness, we don't measure that hidden homelessness in our report. Even in our SNA, it is not there. But we have different activities going on in the city. For example, eviction prevention, right? Like if families have different issues going on and are experiencing, are in the middle of eviction, there are different units that help families to do that eviction prevention work. And yeah, maybe that can play part of the work, but we don't report like the way we report for shelter system flow data. We don't report on hidden homelessness, yeah.
Okay, thank you.
Okay.
Sorry, I want to piggyback on one of the questions that was asked earlier about data quality and the mention of merging clients. And I think this touches upon a variety of things, coordinated access, multiple access points, re-entry of clients. In all of these situations, I just really want to hone in on like how does this process of merging clients or like ensuring that the same, with like we're counting the same client as the same ID in the absence of the different IDs with the client. How does that happen? Algorithm, what's the algorithm? What's the procedure? Yeah.
Okay, good. Thank you. So the idea is in, I don't know if you have experience with HIFIS, but in Toronto we use a different HMIS. We call it SMIS, Shelter Management
Yes, I'm from
Toronto.
Okay.
Victor. Yeah. So in that, when you create intake, the system generates a SMIS ID. So moving forward, it's not a lot of file really. Every month when I work with the data, out of 10,000 files I receive, I get 30 files merged, for instance, or 40 files merged maximum. So it's not like a huge number of files getting merged, but those are people that are identified on an ongoing basis. At some point in time, staff will identify that two Smith ID that was generated in Smith belongs to the same person. So it undergoes file merging. So instead of getting reported as two people now, it's merged now, so it will be reduced to only one person. In some cases, we may open 3 different files, and then moving forward, the staff discovers that those 3 belong to one person, so it will get merged to one person. So it's a back-end work by staff to merge those files, and IT department also gets involved in it. So it's not a huge file that really distorts everything. Out of 10,000 files I receive every month, in most cases like 40 files. So if you divide 40 by 10,000, it's really very dependent, like given the context of the population we are serving, the data we are dealing with, and so on, it's not a significant distortion in the data.
But it is done manually by
Yes.
people who actually working with the clients rather than like, I don't know, systemically, or I don't know if AI has a solution or
AI, no, I have not seen AI. We don't use AI in our for now, but in the future, maybe, who knows? It could even be making me jobless in the future, who knows? But we don't have AI now. We don't use AI now in the city. Yeah. Okay, thank you. Thank you for the question. Yeah.
Hi, my question is for Tyler, but maybe it's for both of you. You mentioned that you have monthly dashboards that you promote publicly, which is great. Are you monitoring whether or not sharing information publicly like that is helping you better manage like escalations in the community?
Yes and no. I know for us, we just want to be as transparent as we can in being able to advocate for different resources in the community. And for us, there's been pushback from government officials on our numbers, actually. So for us, it gives us data as currency kind of thing. So we can come to the table and be like, look, we know that there's at least this many people in our community needing services. Now, whether or not there's pushback from the community, from government officials, that's not really our job to decide on. But for us, we just want to be as transparent as we can in terms of representing the sector in Edmonton and making sure that it's an as honest picture as we can. Yeah.
Thank you.
Thank you.
We have time for about one more question, if anyone has one. I might have one, if that's okay. You both, I think, kind of talked about forecasting also. Could you share more about your upcoming plans on using forecasts and what that would look like? You can also say no if you cannot share more.
I don't know if I can say.
Okay.
I know there is a specific stream of services that we are trying to model into the future, based off of current supply, current need, and projecting future need for a specific type of service. Supportive housing.
Awesome. Thank you. I'll take it. What about you, Wandu?
Yeah, for me, based on the data I work with, for instance, I'm seeing now recently how, because we don't have COB now, and it's a city-funded transition, COB transition that's at least helping us to move people to permanent housing. We are seeing now a shift in the number of people aging into homelessness and exiting from housing, and to see like the future, what's going to happen now? Am I going to see the same thing in 2024? Or I just Googled on the news and I saw that the mayor is pushing, the premier of Ontario was pushing for more COB. So like there are continuous learnings that we do from the data, and it kind of informs, and it's also a collective learning for all of us, right? It's not we don't just throw numbers out there and leave everything. It's a connection between all different levels of government based on what we learn from the data. So yeah, we use the data to see the future, how things are going to happen in the future. Yeah.
I love that. Data as a crystal ball, right?
Of course, yeah.
Awesome.
Yeah.
Thank you. Thank you both. And thank you to the audience too.